There are a number of reasons you may want to consider genetic testing of embryos. If you've struggled with unexplained infertility, unsuccessful IVF cycles, male factor infertility, or recurrent pregnancy loss, pre-implantation genetic screening, PGS, may provide much-needed answers. Often, chromosome abnormalities, primarily extra or missing copies of chromosomes in a cell, are the reason behind a failed IVF attempt and pregnancy loss. PGS may also be beneficial if you're over 35 years old, since the chromosomes within a woman's eggs are less likely to divide properly as she ages, resulting in cells with too few or too many chromosomes. PGS involves testing whether an embryo has the correct number of chromosomes before transferring it to your uterus, where it will ideally implant and develop into a healthy baby. PGS enables your doctor to determine which embryos are genetically normal and possibly improve the safety and efficiency of your cycle. It also helps in the selection of a single healthy embryo for transfer, decreasing the risk of multiple birth and the associated risks to both mom and baby. A different type of genetic testing, pre-implantation genetic diagnosis, PGD, specifically looks for defects that may lead to genetic disorders, such as cystic fibrosis. With CF, PGD is performed because 1/4 of the embryos would carry both abnormal genes and be affected by this serious disease. With some other genetic diseases, half of the embryos will be abnormal. Also, people with certain genetic disorders may have an increased risk of pregnancy loss because one of the partners carries a genetic rearrangement in their chromosomes, translocation carrier. In those cases, PGD may reduce the risk of miscarriage. By avoiding transferring genetically abnormal embryos, PGD can help prevent a baby being born with a very serious genetic disease. Parents-to-be who are concerned about passing on a genetic disease or condition to their children often opt for PGD. While it should be noted that these tests are not 100% accurate, they could be a useful tool for many patients undergoing IVF. The decision to undergo genetic testing can be difficult. Along with your doctor, a genetic counselor is a wonderful resource to help guide you through the process. The counselor and your doctor will explain all the technical and scientific information and make sure you know all the risks, benefits, and limitations. They can also provide invaluable support and guidance as you work through the psychological and emotional aspects of what can be a tough experience. Ultimately, your doctor will provide you with the information you need to make the best choices for you and your family.